Welcome to The Explainer. Today we are diving into a really fascinating study about public health. We're going to look at what happens when a whole country decides to completely rethink how it screens for some of the most common and most expensive diseases out there.
Okay, just look at this number. $1.3 trillion. That's the estimated economic hit from diabetes globally in just one single year. And that is just one disease. So when you start adding in other things, like hypertension, you're looking at an absolutely massive strain, not just on our health, but on entire economies. So, faced with this, Japan decided to try something pretty radical, a huge nationwide experiment, to see if they could actually turn the tide.
All right, let's dive in. First things first, we need to really understand the core problem with these diseases. So these lifestyle-related diseases, or LRDs, they're tricky. They get called silent killers for a really good reason. In the early stages, you can feel totally fine. There are no alarm bells, no obvious symptoms telling you something's wrong. And that's exactly why things like regular checkups are so crucial for catching them early on. So how did Japan decide to tackle this problem head-on? Well, they didn't just tweak the system, they standardized the whole shebang. Before 2008, Japan's system was kind of a patchwork quilt. Every city, every municipality did its own thing, which meant checkups were all over the place. Then, in 2008, boom, everything changed. They rolled out this new, standardized program across the entire country. Every single municipality had to offer the same core checkup with a brand new focus: find the people at high risk of metabolic syndrome before they actually get sick.
And this is where things get really clever from a research point of view. See, this policy change wasn't just some new rule. It actually created a perfect natural experiment, a chance to see what really works in public health.
So here's how it worked. Before this big change, you had some areas that already spent a lot of money on prevention, but then you had other places that spent very little. The new law forced those low-spending areas to suddenly, dramatically increase how much they were investing. And just like that, researchers could compare the health results in these newly investing areas against the ones that were already spending a lot. It was a perfect way to isolate the impact of the new program.
So, the big question is, did it work? Did forcing local governments to pour more money into these standardized checkups actually make people healthier? Well, the data is in. And what they found is pretty incredible. The program led to a 10.4% drop in people being diagnosed with a single one of these diseases. That's great, but look at that second bar. For people with multiple conditions, the more severe cases, the reduction was a whopping 35.8%. This tells us the program was most powerful at preventing the really serious, complex health problems.
And the effects went way beyond just diagnoses. It actually changed people's day-to-day behavior. In those areas that had the biggest jump in investment, researchers found that more people quit smoking, they started drinking less alcohol, and they got more physically active. I mean, they were literally taking more steps every single day.
But, and this is a really crucial detail the study uncovered, these health benefits were not shared equally by everyone.
The improvements were really concentrated in a few specific groups. People who were self-employed and people who were homeowners saw major drops in disease diagnoses. But the study found no real statistical improvement for people who were unemployed or for renters. And this suggests that while the program was incredibly powerful, its benefits didn't quite reach everyone, especially folks in more vulnerable socioeconomic situations.
Okay, now for the financial punchline of this entire experiment, and I'm telling you, it is genuinely staggering. Let's talk about the return on investment.
So first, the cost. The total price tag for getting all those low-spending towns and cities to ramp up their health checkup programs was an extra $23.7 million. Okay, but what about the savings? Well, in those exact same areas, the reduction in medical spending, the money they didn't have to spend treating these diseases, was over $216 million. So let's put that together. For every single dollar that was invested in expanding these preventative health checkups, the system saved $9 in treatment costs down the line. A 9-fold return on investment. Just amazing. The results from Japan's experiment seem crystal clear. Standardized, focused prevention saves lives, and it saves an incredible amount of money. Which leaves us with one final, kind of provocative question to think about. If the evidence is this strong, why does preventive healthcare all around the world remain so consistently underfunded?